If you watched my last video, you already know what a PMHNP is and what the day-to-day of the role actually looks like. If you haven't seen it yet, go check it out after this. I'll link it in the description below. Today, we're going deeper because knowing what a PMHNP does is one thing, but knowing exactly how to become one is a completely different conversation. And that's what this video is all about. I'm walking you through the complete step-by-step roadmap from where you are right now, whether that's a bedside RN, a nursing student, or someone who has been thinking about becoming this for months, all the way to licensed, board-certified psychiatric prescriber. There are 12 steps to this roadmap. Some of them are quick, some of them will take years, but every single one of them is knowable, plannable, and achievable. And by the end of this video, you will have a clear picture of exactly what the path looks like. Let's get into it. Before we dive into each step, here's the full roadmap at a glance so you can see where we're heading. Step 1, RN licensure and experience. Step 2, choose your degree path. Step 3, select and enroll in a program. Step 4, complete your didactic coursework. Step 5, complete your clinical hours. Step 6, graduate and apply for your board exam. Step 7, pass your board exam. Step 8, apply for your APRN license and prescriptive authority. Step 9, obtain your DEA Registration and NPI number. Step 10, secure malpractice insurance. Step 11, land your first PMHNP position. Step 12, begin practice and pursuing continuing education. 12 steps, some overlap, some happen simultaneously, but this is the complete picture, and we're going to go through every single one. Step 1 is where every PMHNP's journey begins, your registered nursing license. To become a PMHNP, you must first be a licensed RN. That means passing the NCLEX RN and holding an active nursing license in your state. If you're already an RN, you've already completed step 1. Check. Now, here's the question that comes up a lot. Do you need nursing experience before applying to a PMHNP program? The short answer is it depends on the program. Some programs require 1 to 2 years of RN experience before you can apply. Others accept new graduates directly into the MSN or DNP program. You'll need to check each program's specific requirements. That said, even if a program doesn't require experience, having clinical background as an RN makes you a stronger student, a better clinician during rotations, and more competitive on the job market when you graduate. Psychiatric nursing experience specifically is valuable, but it's not the only path. Med-surg, ICU, emergency, all of it builds the clinical foundation you'll draw on as a PMHNP. Step 2 is one of the most important decisions you'll make on this journey. Choosing between an MSN and a DNP. MSN stands for Masters of Science in Nursing. DNP stands for Doctor of Nursing Practice. Both degrees will qualify you to sit for the PMHNP board certification. Both will give you prescribing authority. Both will make you a fully licensed psychiatric nurse practitioner. The difference comes down to 4 things: time, cost, depth, and future-proofing. The MSN is typically 2 to 3 years and runs between $30,000 to $60,000 on average. It's a clinical degree focused on direct patient care, and it gets you into practice faster. The DNP is typically 3 to 4 years, costs more, requires more clinical hours, at least 1,000 versus 500 for the MSN, and it includes a scholarly project or doctoral capstone. It's the highest clinical degree available for nurse practitioners. Here's the thing you need to know about the DNP. The American Association of Colleges of Nursing has recommended the DNP as the future entry-level standard for nurse practitioner practice. That shift hasn't been universally implemented yet, but it's coming. If you're early in your career and thinking long-term, the DNP is worth serious consideration. I have a full video dedicated entirely to the MSN versus DNP decision coming soon. But for now, here's the simple framework. If speed and cost are your primary factors, MSN. If you're thinking about the long game and the highest credential, DNP. Step 3 is choosing the right PMHNP program. And this step deserves more attention than most people give it. Not all programs are equal. The program you choose will determine the quality of your clinical training, your board exam readiness, and how you're perceived by employers. Here are the most important factors to evaluate. First, accreditation. Only apply to programs accredited by CCNE. That's the Commission on Collegiate Nursing Education, or ACNE, the Accreditation Commission for Education in Nursing. These are the gold standard accrediting bodies for nursing programs. A non-accredited program can leave you ineligible for board certification or state licensure. That's a non-negotiable. Second, clinical placement support. This is the single most important operational question you can ask a program. Ask them directly. Do you help students find clinical preceptors and placement sites? Or is that entirely the student's responsibility? Programs that leave clinical placement entirely on the students can leave you scrambling, and that directly delays your graduation. Push for a real answer before you enroll. Third, board pass rates. A strong program will have an 80% or higher first-time board pass rate. Ask for the data. If they're evasive about it, that tells you something. Fourth, cost. Compare total program costs, not just per credit tuition. Factor in fees, books, technology, and the cost of your board exam. Look into financial aid, employer tuition reimbursement, and scholarship opportunities before ruling anything out on price. I have a dedicated video on how to choose the right PMHNP program coming soon. It goes deep on red flags to watch for and the questions to ask before you sign anything. Step 4 is your academic coursework, the classroom component of your program. This is where you build the theoretical and clinical knowledge foundation you'll carry into practice. A well-structured PMHNP curriculum covers advanced pathophysiology, advanced pharmacology, advanced health assessment, psychiatric theory across the lifespan, psychotherapy modalities, and the psychiatric and mental health specialty content you'll be tested on for the boards. This is also where most of your psychopharmacology knowledge is built. And I want to flag this early because pharmacology is the most heavily tested domain in the PMHNP board exam. Pay close attention in those courses and make sure you're taking detailed notes. That investment will pay off when you're sitting for the boards. Most MSN programs run between 45 and 60 credit hours of coursework. DNP programs run between 75 and 90 credit hours and include additional research, leadership, and evidence-based practice content. Step 5 is clinical hours. And for many students, this is the most challenging and the most rewarding part of the journey. Clinical hours are your hands-on supervised patient care training. For MSN programs, the minimum is 500 hours. For DNP programs, the minimum is 1,000 hours. These hours are completed under the supervision of a licensed preceptor, typically a PMHNP, psychiatrist, or other qualified mental health provider. During your clinical rotations, you'll conduct psychiatric evaluations, develop treatment plans, prescribe medications co-signed by your preceptor, manage ongoing patient care, document clinical encounters, and present patients to your supervisor. You'll make mistakes. You'll get feedback. You'll get better. That's the process. 2 critical pieces of advice here. 1, start looking for preceptors earlier than you think you need to. I mean, at least 1 full semester before your rotation begins. The shortage of willing preceptors is a real challenge in many programs, especially in certain geographic areas. Start networking. Reach out to providers you work with as an RN and use your program's placement resources aggressively. 2, don't limit yourself to one setting. Diversity in clinical experience across outpatient, inpatient, telehealth, and specialty populations will make you a significantly stronger clinician and a more competitive job candidate when you graduate. Step 6, graduation. You made it through the program. Take a moment. This is a significant accomplishment. Now, don't stop. The window between graduation and your board exam is one of the most important periods of your PMHNP journey. What you do in these weeks matter. Immediately after graduation, you'll apply to sit for the board certification exam. There are 2 options, the ANCC PMHNP BC and the AANP PMHNP C. I have a full dedicated video coming soon, breaking down the differences between both exams, which one to choose, what's on each one, and how to prepare. Once your application is approved, you'll receive your authorization to test, or your ATT, and you can schedule your exam date. Most candidates schedule within 60 to 90 days of graduation to keep the material fresh. Step 7, passing your boards. This is the milestone that officially makes you a board-certified PMHNP. Here's what I want you to hear about board prep. Start early, study consistently, and do practice questions every single day in the final month. Don't try to cram everything in the last 2 weeks. The PMHNP board exam is comprehensive. It covers pharmacology, diagnosis, psychotherapy, health policy, ethics, and lifespan psychiatry. It rewards consistent preparation over last-minute cramming. A structured board review course is worth every dollar. Fitzgerald, Berkeley, Georgette, and Blueprint are the most commonly used and well-regarded options in the PMHNP community. Pharmacology is your priority. Know your drug classes, mechanisms of action, side effect profiles, contraindications, and clinical pearls code. Know your DSM-5 diagnostic criteria for every major psychiatric disorder. Know your safety frameworks such as the Columbia Protocol, the PHQ-9, and the CAGE-8. When you pass, and you will pass, take a breath. You have earned it. Step 8, applying for your APRN license and prescriptive authority in your state. Passing your boards does not automatically give you the legal authority to practice. You need a state license. Every state has its own application process, its own fees, and its own processing timeline. Some states take 2 weeks, some states take 3 months. Apply the same week you pass your boards. Don't wait. Prescriptive authority, your legal right to prescribe medications. This may be bundled with your APRN license in your state, or it may require a separate application. Check your state board of nursing specific requirements. One more important note here. Scope of practice varies significantly by state. Some states grant full practice authority to PMHNPs, meaning you practice completely independently with no physician oversight required. Other states require a collaborative practice agreement with a physician, especially for new grads. Know your state's requirement before you start your job search. Step 9, your DEA Registration and NPI number. Your DEA registration is what authorizes you to prescribe controlled substances like benzodiazepines, stimulants for ADHD, sleep medications, and others. You apply directly through the DEA website at dea.gov. The registration fee is approximately $888 and covers a 3-year period. Your National Provider Identifier, or your NPI number, is a unique identification number required for billing insurance. If you already have an NPI from your RN practice, you may need to update it to reflect the new APRN credential. If you don't have one, apply at nppes.cms.hhs.gov. It's completely free and typically processed within 1 to 2 weeks. Both of these should be completed as soon as your APRN license is issued. Don't wait until you have a job offer. Have them ready to go. Step 10, malpractice insurance, also called professional liability insurance. This is a non-negotiable. You need it before you see your first patient, period. For most outpatient PMHNP rules, individual professional liability coverage runs between $100 to $300 per year, one of the most affordable forms of professional protection for the risk it covers. Some of the most commonly used insurance providers for NP include NSO, CMNF Group, and HPSO. All three offer NP-specific policies. There are two types of malpractice insurance: occurrence-based and claims-made. Occurrence-based covers any incident that happened during the policy period regardless of when the claim is filed. Claims-made only covers incidents reported while the policy is active. If you're considering claims-made coverage, make sure you understand tail coverage. When in doubt, occurrence-based is simpler and more comprehensive. Step 11. Landing your first PMHNP job. This is an exciting and sometimes nerve-wracking transition. Here is what I want you to focus on. First, don't just look at the salary number. Look at the total package: malpractice coverage, CME allowance, supervision structure, patient volume expectations, schedule flexibility, and sign-on bonuses all matter. A job that pays $5,000 more per year but offers no supervision support, has an unrealistic patient panel, and includes a non-compete clause that locks you into a 25-mile radius for 2 years may cost you significantly more in the long run. Second, new grads specifically should prioritize supervision and onboarding support. Your first year of practice is steep. Having a strong supervising structure, even in a state where it's not legally required, will make you a better clinician faster. Third, do not underestimate telehealth as a starting point. Telehealth PMHNP rules are abundant, offer pay competitively, and give you exposure to high patient volume quickly, which accelerates your clinical development. If you want a dedicated video on landing your first PMHNP job, let me know in the comments. Step 12. You are a practicing PMHNP. Let that sink in. You completed the journey. You're doing the work. That is not a small thing. From here, the path continues into the form of continued education. Your board certification must be renewed every 5 years. Both the ANCC and AANP require 75 CE hours per renewal cycle. These hours can be completed through conferences, online modules, webinars, publications, and a variety of other approved activities. Beyond the CE requirement, the most important thing you can do now as a new PMHNP is stay curious. This field moves. New medications get approved, guidelines get updated, research changes our understanding of psychiatric conditions. The clinicians who stay engaged with the literature and continue developing their skills are the ones who build the strongest, most sustainable practices over time. And if private practice, entrepreneurship, or building something of your own is on your horizon, the foundation you've built through the entire journey gives you everything you need to do it. That's the complete PMHNP roadmap. All 12 steps from RN to licensed psychiatric prescriber. Now, I know that's a lot of information, and I built an entire resource to help you reference it whenever you need it. It's called the PMHNP Blueprint Complete Edition. And it's a more comprehensive guide that covers every step of this journey in detail, including program selections, board prep strategies, salary ranges, licensing steps, and a full roadmap you can follow wherever you are right now. The link to download is in the description below. If this video was helpful, please subscribe, because every video I put on this channel is designed to give you the clearest, most practical psychiatric education and career guidance available. We have a lot more coming. In the next video, we're tackling one of the most debated questions in the NP world: MSN versus DNP. Which degree should you actually choose? What does each one cost you in time and money? And how do you decide? That video is next. I'll see you there.